guys, it's Finn. I've been asked if I would do a video about massaging top surgery scars, because I speak a lot about how I'm quite routined in doing that twice a day, so I thought I'd share what I do with you. I have to say though, I have no medical training, I'm not a qualified masseur, none of that. I've just literally had a look online, done my own research, looked at other videos and kind of made my own way of massaging. So if you are concerned at all, please do check with your surgeon or GP or what have you. So that's the warning out of the way. Okay, so for massaging, the best thing to do is to wait until you are completely scab free. Make sure those nipples are completely healed. You don't want to be using massage oil on nipples that still have scabs, because you want those scabs to dry out so they can fall off. So I waited till it was about 6 weeks post-op, I believe. Once those scabs had gone, I started massage. You also don't want to start the massage too early, because depending on the technique your surgeon uses, Mr Yelland uses internal stitching, so you also don't want to be moving things around there too much until that's settled. So at about 6 to 8 weeks, when you are scab free. And what I like to use very holistic natural stuff. So what I've bought is, after doing lots of research, I will put some links at the bottom to the research that I did and what I found. But I have heard a lot of really good things about tamanu oil as being very, very good for scars and for scar healing, even working on very old scars. So I went for using some tamanu oil. Now, it's got a very, very strong smell. I personally quite like it. Some people aren't so keen. It's kind of a bit woody and a bit grassy, and quite strong. So, and it's also expensive. So if you did want to weaken it down a little bit to stop it smelling so much, and also so it doesn't cost you as much, you can mix it with another oil. And rosehip seed oil is also highly recommended for scars, so I've been using a combination of these two. It's always a really good idea to get very clean, cold pressed oils, 100% organic. You don't want oils that have been messed with. And how you mix them is really up to you. I usually mix about 70% to about 30% of this, depending on how much I've got of each. It doesn't really matter. Sometimes I do it with just pure tamanu. It's really up to you. And talking about brands, I actually prefer this brand, the Zebra, however you say it. Some of the oils have got a more pungent smell than others, and I like the smell of this one, and it just feels like a really good oil. It's one of the more expensive, but I really do like Zebra, however it's said. So I then just get a little pump bottle like this, and so I can mix the two in here. And then all I literally do is a few drops of that, and then just warm it up in your hand. It's always good to have the oil a little bit warm. Sometimes, I haven't done it very often, it's got to be said, is just pop it in a little bit of warm water to warm the oil up itself. So once that's a bit warm in your hands, in early days when you've just begun to heal, you want to go very, very gently. So just using a couple of fingers, literally just go along the incision line. In the very beginning, that's all you really want to do. Gentle but firm pressure. You can do it both hands at once, or you can just take one at a time. And it's also good because you're stretching. You do need to stretch. Keeping the scar stable while stretching is good, but stretching will help the scar's mobility. So yes, just literally going along the line of the incision, and the other one as well. And you want to go kind of, so you're actually on the incision itself, but also above and below it as well. I found it easier to go this way in the beginning than going that way. So in the very beginning I would just literally go out to the side. It does a couple of things. It's lymph drainage, so it helps get rid of any fluid under there. And it also helps to break down the tissue underneath the scar, because the way a scar heals isn't just on the surface. As I've said before, it heals down the line, underneath it heals as well. So what you want to be doing is breaking down all of that collagen that makes up the scar, so that it's not being pulled. Because what causes a keloid and hypertrophic scars is when all the collagen bunches up underneath, and that's what causes it to be raised and bumpy. So by doing this, you're breaking down all of that scar tissue underneath. So just very gently but firmly, and for like 10 minutes if you can manage it. I just used to sit there with my top off whenever I was having binder breaks and just literally just do this. the rule with anything, if it hurts, stop doing it. And I'd also say with the oil, although this is really good oil, the fact of the matter is it's the massage that's been shown to have the most effect, regardless of what oil you use. Oils do have certain properties that are helpful, but all that research out there does really point to the fact that it's the actual massaging the scars itself that helps the scars to heal. So yeah, first few weeks just literally doing this, and then as it all starts to feel a bit more stable and you feel kind of less kind of scared about touching them, you can go a little bit more rigorously and go both directions and using more pressure each time. Just literally like that. Once it's what you want to do is keep doing it really till it's dried in, and then you apply, if you're using it, Celakote on top. Silicone scar treatment has been shown to be very effective. Again, whether it's the massage or the thing, it's really hard to work out whether it's one or the other. But I was recommended to use Celakote. So once the massage oil is all soaked in, I then apply a thin layer of Celakote on the top after every massage session. Try and do this twice a day. If I'm at home studying and I've got a study break, 3 times a day. Okay, so once you've done that for a few weeks, you can get, I put way too much on, you can get a little bit more vigorous. So at about a month in, I started to do it with just using like 3 fingers, just doing round circles, go towards the outside. Again, it helps to kind of get rid of build up of fluid. I still had fluid build up for a good 2 or 3 months. So going in circles like that is really good. Break that down. I didn't massage the nipples in the very beginning. I didn't do that until probably about 2 or 3 months in. When they were a little bit dry around the edges, I just gently put some of the Tammany oil on them. I pretty much left them to their own devices for quite some time. I am massaging them now, but I'll tell you about that in a minute. So yes, a few weeks into healing, when it's all a bit more stable, you can be a bit more vigorous. So first stage like this. After a few weeks you can add this, so that when you're massaging you can do a combination of the both. And then gradually as the weeks go on you can be more and more vigorous, so go from doing a few fingers to doing a whole hand, all 4 fingers, and being quite firm like that. Okay, so it's just a combination of those 2 things. What I like to do as well, as I got more further along, was to kind of really do that as well, because again you're moving that scar from underneath, so that is a lot more pressure on that though, so you want to wait till you're a few weeks in for that. I feel like there should be some Barry White music on in the background with this or something. Right, now one of the techniques I heard a lot about, especially for hypertrophic scarring and keloid, is to be very, very vigorous on the scar. And there's a technique whereby you actually pick the scar up from the underneath skin. Now that you mustn't do until you're a good sort of 3 months in, really. And again, stop if it hurts. So with this kind of massage, I literally pick the scar up like that, almost like pinching and letting go, back and forward along it like that. And the same with that one. And you could do it that way as well. So you literally kind of pulling the skin forward as much as possible, and again that will stop the scar from adhering to the skin underneath. And it could be, that's also what that does as well, because you're pulling that scar up and pushing it down. So yeah, you want to really separate that scar from the skin underneath. It looks really aggressive, doesn't it? At this stage now, I'm just coming up to, goodness, I'm 11 months post-op now. A whole year next month, it's amazing. So yeah, it's basic common sense. In the very beginning, just gentle, light pressure, and then as time goes on, increase the pressure and increase the movement to go in circles and up and down. And then once the scars are very, very stable, you can be a lot more firm and really pick that scar up from the underneath skin. And that's it really. As with nipples now, I'm this far on, my nipples do get dry, so I do massage those as well, just to keep those healing. They are taking their time to kind of look normal again, and now that they're completely healed, I'm not worried about massaging them as I was in the beginning. So I hope that's helpful. as I say, it's really common sense. Just stop if something hurts, go gently, build up to more vigorous. Try and do it at least once a day. Once you've done it, cover it with something that will moisturise it throughout the day. A scar needs to be massaged to break down, and it needs to be moisturised to heal well. And obviously it's not just about the massage. You can be the best masseur in the world, but if you're not taking care of yourself, those scars are not going to heal. So try and think sensibly in terms of lots of water, lots of fresh veg, lots of exercise, all those kind of things to take care of yourself. So you know, you're eating 10 tonnes of chocolate and you're kind of sitting around just drinking coffee all day, it's not going to help. Something very detoxifying like green tea is good. And lots of vitamin C. The article I'm going to put at the bottom talks about how it's been shown that huge amounts of vitamin C after surgery can really help with the healing process. So I got myself the dissolvable vitamin C and would take that a couple of times a day as well for the first few months. So yeah, just take care of yourself and take it easy. Balance a bit of action because you do need to keep those scars mobile. If you're very early days, keep the binder on when you're doing your exercises, but then when you've got the binder off, just spend a few minutes doing this and your scar will heal, should heal nice and flat. Well, I hope that's helpful. If anything else, I haven't covered in this stuff now. Anything else I can do, or if you want anything else clarified, just give me a shout and I'll do what I can to help. Take care guys, see you soon.